This is Dr. Robert Bates at Leominster Chiropractic Spine and Injury Center. Today we're going to take a look at some new technology we have in the office called DMX, or Digital Motion X-ray. This new technology allows us to pick up problems in the neck looking directly at real-time function and all the different ranges of motion in the neck. These particular videos produce about 30 images per second and can show problems that have been missed with regular X-ray, CAT scan, and even MRI. Usually when there's an automobile accident or neck trauma, there are tears of ligaments in the cervical spine that are almost never diagnosed. This technology allows us to be able to find these problems and specifically treat people. In this first video, we're going to look at the neck from the side, bending forward and bending backward. We can see spurring here with loss of motion. We can see some hypermobility here and here, but it gives us a very good idea of the real neck motion. And sadly enough, even a chiropractor that is very good with his hands, the interreliability is usually poor for what is palpated and what we think we should adjust and increase motion at. So now we're able to see exactly what needs to be done, what segments should not be ever adjusted, what segments need adjustment to get normal function back in them. Very interesting technology. This is a representation of the upper part of the neck, looking at it from the back. This is the back of the skull, and this shows some of the ligaments that are present, but there are many more. Two very important ligaments that are torn and almost never diagnosed are the accessory ligaments and the alar ligaments. These control the amount of motion between the first two segments in lateral bending. Now, if we look at a study of a severe tearing of those ligaments, I'll show you what can happen when we see this motion. Here's a study looking with the mouth open at the two top vertebrae, as I just showed on representation of a diagram. There's a severe sliding of C1, the top bone, on C2. This person was missed at the ER, missed with follow-up X-ray, CAT scan, MRI. They don't look at these things. This is complete tearing of the alar ligaments, creating instability of the upper neck, an irritation of various parts of the brainstem, disequilibrium, migraine headaches, and like so many of these patients, about 70% of headache is from the neck, and they are never diagnosed and live on medication. Digital motion X-ray is a phenomenal type of technology that can allow us to find problems that have not been seen with any other technique. It allows us to be able to diagnose exactly and therefore treat exactly what your neck problem is. And in many, many cases, we give patients tremendous relief that they have not obtained from any other source. Have a great day.